Right, as people start coming into the room, we want to give a warm welcome to everyone. Welcome to today's Prevention Community of Practice session. My name is Danny Hansler. I'll be your tech producer. We're so glad you could join us for this event, continuing the CARE RCOs across New Hampshire. This session is sponsored and facilitated by Growth Partners, New Hampshire Technical Assistance Center, the Foundation for Healthy Communities, and the New Hampshire Department of Health and Human Services. We're grateful to our partners for making today's conversation possible. Before we begin, we just want to go quickly over some housekeeping items. First, the Zoom tips to help the session run smoothly. Please stay muted unless invited to speak or participating in the program. You're welcome to leave your camera on or off, whatever makes you most comfortable. Please also avoid sharing any personal or confidential information in the chat. We also encourage to use the engagement tools that Zoom has for us. We encourage you to participate throughout the session. We're not against emojis, and you're welcome to use the chat for posting questions or general comments and share helpful resources applicable to the discussion. Also, a quick comment about the CEUs and the evaluation. This is a free training, and CEUs are available to those who attend the full session and complete the evaluation that will be shared with you at the end of it. With that in mind, I'll now hand things over to today's moderator, Dan Andrews from the Foundation for Health Communities, who will kick us off and introduce our presenters. Dan?
Thank you so very much, Danny. It is a personal pleasure for me to host this particular session of the Community of Practice. Our recovery community centers are such a vital part of the work of combating substance use in New Hampshire, and we have one of the very best speakers. What we're going to do today is to talk about the state of our state in the recovery community organizations and see what's happening, because so much is happening within our society and the nonprofit sector. Explain how Harbor Care functions as a facilitating organization and supports the development and sustainability of New Hampshire's RCOs, and identify some key differences among RCOs in the state, including the range of programs and services they provide. Today's presenter is Elyssa Sage. She is the Assistant Project Director, and she has been working in the substance use and recovery field for just over 7 years. She's currently the Assistant Project Director for Peer Recovery Support Services, facilitating organization at Harbor Care. In this role, she is responsible for expanding quality peer recovery support services by supporting recovery community organizations in the state of New Hampshire. She helps with quality assurance and improvement measures by monitoring contract compliance, overseeing data integrity, reporting technical assistance, and providing organizational coaching and training to recovery community centers. She also does consulting work for recovery centers across New England. Prior to her current role, she worked for the City of Nashua, Department of Public Health and Community Services, to help develop that region's continuum of care for substance use and facilitate stakeholder collaboration and integration to address identified gaps and barriers in addiction treatment services. She holds a Bachelor of Science degree in Public Health from Colby Sawyer College and a Master's degree in Public Administration from Clark University. And it's my great personal pleasure to welcome Elyssa Sage to the Community of Practice.
Thanks, Dan. That was quite the intro. Thank you.
I have more.
No, please. That was already too much. But thank you for the intro. And just, I guess, before we start, it'd be helpful for me to get a sense in the room if you want to throw in the chat or use some kind of emoji. If you are familiar with recovery community organizations, or if you know who your local RCO is, maybe a hand raise, thumbs up, anything? Yeah, okay. Awesome. Okay, a couple of you, that's awesome. Glad to see that a couple of you already know. I'm sorry this is going to be repetitive, but hope that you also learned something anyway. And for those that are less familiar with RCOs, I hope I get to introduce you to some really valuable resources today. Oh, sorry, next slide. So I'm not going to go all the way back to the very beginning, but I do want to kind of set the context of where this kind of whole project started, of when the state kind of invested in building the infrastructure of recovery community organizations across the state. So they first contracted with what we call the facilitating organization in 2016, right? And from 2016 to 2019 was kind of like our highest peak in overdose death rates, where we reached third in the nation in 2018 for 31 deaths per 100,000 persons. Annual economic impact is about 2.36 billion. And since that time, New Hampshire has really gathered a lot of resources and investments to try and increase access, build workforce capacity. They built the doorway system through a hub and spoke model to help coordinate services, right? And so one of these resources and investments that the state has made since that time is the investment in recovery community organizations and increasing their capacity and access across the state. I do just like to throw in today's kind of impact as well, because like although we are dropping in rank, we're now 21st in the nation for overdose death rates, according to the most recent available CDC data. The overdose death rates are still climbing, right? So today we're at 36 deaths per 100,000, even back in 2016, 2018, when we were third in the nation with 31 overdose death rates per 100,000. So New Hampshire is very much still impacted by substance use disorders and opioid use. So although we have made a lot of investments, we still have a lot of work to do and lives to save. So the state initially invested in this kind of infrastructure back in 2016. Our very first contract was only for $80,000, and it was to kind of assess the readiness of grassroots organizations across the state to be able to build a recovery community organization. And the ultimate goal of this investment was to ensure quality peer recovery support services were accessible across the state. And they did that through providing funding and technical assistance to recovery community organizations. So I want to make that very clear, because in today you might find peer recovery support services integrated into different settings, right? Some hospitals hire CRSWs, they do recovery coaching. This contract specifically builds the infrastructure for recovery community organizations that offer peer support services. So this is what today's infrastructure kind of looks like. When we first got this contract, we started with 3 centers in the entire state. We now have 21 subcontracted under us. At Harbor Care, I believe there are 23 in the entire state. So there are 2 that elect not to subcontract through Harbor Care, but so we subcontract with 21. There is an RCO in every single public health region. And Harbor Care has served as what we call the facilitating organization since the original contract in 2016. And I'll get into a lot more detail about what the facilitating organization actually does. Just a little plug here for Harbor Care. For anyone who doesn't know, we do provide services across the state, but we are primarily located in Nashua, New Hampshire, with the ultimate goal of breaking the cycle of homelessness through housing, healthcare, and veteran support services. So kind of providing that holistic wraparound care from any one of these programs to end the cycle of homelessness, which of course addiction has a huge part in. So Harbor Care, there's a whole RFP process, right? Harbor Care applied and received the contract as the peer recovery support services facilitating organization in 2016 to support the infrastructure and ensure quality services were being provided at recovery community organizations. So what we do, this is very, very simplified, and I'm going to go into each of these a little bit more, but we provide funding technical assistance, and back office support to all of our subcontractors. And you might need to click again. I think there's more on this slide. Yeah, just you can keep clicking. Yeah, thanks. So funding. What originally happened, right, was when the RCOs were first starting, right, they weren't even established nonprofits. They had no financial history or capacity to apply for their own grants, right? So that it was one of the initial purposes of Harbor Care. We applied for grants on their behalf and acted as that kind of pass-through for funding. Now we don't do that as much because the RCOs have built themselves up and are kind of have the internal capacity to apply for and manage their own grants. But we do still have some opportunities where we're able to apply for funding as a collective, which presents really good opportunities for collective impact, and it decreases competition for dollars within the state of New Hampshire. So the use of the facilitating organization as kind of like this pass-through entity really alleviates some of the administrative burden from our funders and from our subcontractors, right? So if you can imagine, if Harbor Care did not exist, BDAS would be responsible for managing 10 subcontracts and their compliance and 10 invoices and 10 budgets. And for anyone familiar with the state's contracting process, to have to do that 10 times instead of one would be an absolute nightmare. So that really kind of alleviates a lot of administrative burden on the state's end on only having to contract with Harbor Care and manage one budget and one, governor and council agenda and things like that, the whole process. Then on the RCO's end, Harbor Care kind of takes on the burden of the compliance with the state, right? So we communicate with the state. We also do all of their kind of reporting and administrative deliverables for them. So kind of alleviate some of the burden on our subcontractors' end as well. So BDAS accrues all the funding, passes it to Harbor Care. Harbor Care subcontracts out with all of the RCOs. I get questions all the time about what that funding breakdown kind of looks like. And so I try to provide a summary down here. So 81% of our funds go directly to the subcontractor to, manage their overhead, make sure services are being provided in their communities. And then on Harbor Care's end, we're about 15% for our admin fees, which currently are 7.5 employees, and all of Harbor Care's back office support, which I'll talk about a little bit later. But then in addition to that, there are 4% of what we call shared costs that Harbor Care takes on that cost for all of the RCOs as a collective. So one example of that is that we pay for all of their use of an electronic health record. We pay for all of their use for a learning management system so that we can ensure that they're in compliance with HIPAA, 42 CFR, confidentiality, cybersecurity practices, all of that. We also provide a lot of trainings and scholarship dollars for the RCOs to make sure that their workforce is ready and has the most up-to-date information to provide the best services. And then we also do some marketing on the RCO's behalf. So back office support. So in addition to the 7.5 employees that work directly on this grant, our subcontractors also get access to all of Harbor Care's back office support. So if you can imagine, most of these centers they're all nonprofits, and they might range from like 5 to 20, maybe 30 if it's a big one, but like 5 to 20 employees, right? They do not have human resources departments. They do not have a finance department. They do not have a billing and credentialing department, right? So they leverage Harbor Care in those ways. So if they need HR, they can contact us and we'll get them in touch with our HR department. We budget and process all of their invoices for them with financial assistance. And then we also help them become credentialed in Medicaid and connect them with a third-party biller for submitting and processing claims. So all of that back office support is paid for by the contract and has like no cost to the RCOs. They can use us kind of a la carte whenever they need us for whatever they need us for. And then the third part of this is our technical assistance. So this is really the part where we're ensuring quality, right? So whether that's administrative support, quality improvement, capacity development, one of the largest projects we work on for all of our subcontractors is what we call the Standards of Excellence, the New Hampshire Recovery Community Organization Standards of Excellence. Just purely for understanding, I will compare it to an accreditation process, but it is not a formal accreditation. But basically, it defines standards for services and kind of organizational governance that the Harbor Care then helps them meet those standards. And then BDAS as a third-party evaluator comes in and assesses their ability to meet those standards. So that's a very big project that's always ongoing for us and the RCOs. We have also, wait, can you jump back? Sorry. So something that has been a real benefit to the subcontractors as of recently is part of organizational coaching. So if you can imagine during the COVID-19 response, Harbor Care as an FQHC had access to a lot of resources that the RCOs did not, whether that's the most updated kind of policies and procedures and recommendations from the CDC, access to PPE, COVID tests, thermometers, all of that kind of chaos that happened during COVID-19. We kind of facilitated and made sure that the RCOs were operating with the most up-to-date recommendations. So that was a huge, huge benefit that we didn't really ever anticipate the FO serving in that kind of function, but we had to adapt in that time. And then we also do a lot of quality improvement and data analysis and evaluation through the use of their electronic health record. Now you can jump, sorry. Okay, so before I jump into, that's just kind of all of Harbor Care and what the facilitating organization does and how we support the recovery community centers. Before I jump into the recovery community centers, are there any questions on like the Harbor Care end of things? It's a lot to try and explain, but basically anything the RCOs need, we would help them with. Okay, no questions. So recovery community centers, they are all nonprofits. They do non-clinical peer support services. And New Hampshire, you'll find, defines peer very broadly. You might find in other settings that peer is very strictly limited to the individual with experience in recovery or addiction. We do not restrict the word peer to that kind of definition. It could be someone in long-term recovery, it could be their family, or it could be a friend or an ally. So peer is very broad in this sense, but they're all community driven. They assist people in building what we call recovery capital, which is the internal and external assets that would help someone sustain recovery, right? When you kind of think of things like engagement in their community, their self-satisfaction, like things like that. They are also great hubs in your community to mobilize resources. So your local recovery centers have all of the connections with treatment, with healthcare, with insurance, with housing, with employment, kind of like any kind of resource someone in any stage of their recovery journey, they could be actively using, they could be 10 years in recovery, like any kind of stage of recovery. Someone could come into a recovery center and ask for a resource and they would get it. Absolutely no cost. There is no cost to participants accessing services through a recovery center. It's all free. And the primary service that all recovery community centers provide is what we call peer recovery support services. These are is a peer-based model, right, that engage individuals in the recovery process, whatever stage of that recovery process the person is in. They will help. So no kind of abstinence requirements, nothing like that to engage in a recovery center. Anyone can walk through the door and get help. So when I talk about peer recovery support services, I'm really referring to 3 core services. It's recovery coaching, which is kind of one-on-one support that is really based off of a recovery plan, right? So they're making recovery goals, they're tracking progress, things like that. Then you have telephone recovery support, which are really more of kind of really wellness checks, like, hey, how you doing? Or they might need a really quick resource or referral, like, hey, what meetings do you have going on this week? I need to get to a meeting, something like that. And then the third one is community-based activities. These are going to be like your mutual aid meeting. So your all recovery, your art and recovery. Some of them do group hiking events, art, music, yoga, any kind of group activity that kind of facilitates community in the center, they will offer. And again, all of these services are free. So what does it mean to be community driven? The easiest way to, if you're a visual person, if you kind of picture that organizational triangle, right? Nothing in the recovery community center happens from the top down. It all is influenced from the bottom up, right? So this looks like your local community and stakeholders playing a central need and identifying the needs in your community. It's a participatory process, right? So all of the centers have what we kind of call a participant advisory panel. So kind of like a little board of participants of your center kind of influencing and telling you what they would like to see for programs, right? How things are going, what the gaps are in the community, things like that. A lot of collaboration and partnerships happen because again, they all provide those 3 core services. But when we get down to the next couple of slides, you guys will really see that they all provide those services in different settings and with different partners to kind of meet their community needs. And then programs and services are all informed and implemented with these things in mind. Okay, so I'm going to go through every one of our subcontracted RCOs. So there's 10 of them. I'm hoping through this, you guys might be able to kind of see what community driven looks like, right? Because they all provide those 3 core services, but you'll see that they all provide them in different kind of light. And then I'm hoping I'll also get to introduce you, for those that don't already know, who your local RCO is, and how you can get in touch with them. So these are just alphabetical, so no particular order, but we'll start in Milford. Milford has what we call ARC-NH, Addiction Recovery Coalition of New Hampshire. And while, again, they provide those 3 core peer recovery support services, what is kind of unique about ARC is that most of their staff is actually dually trained in mental health and substance use peer support. They are the only RCO that has a veterans coalition. They offer a lot of family support. They have a very strong collaboration with Better Life Partners to help facilitate access to medication-assisted recovery. And they are also members of their Adverse Childhood Experiences Mobile Response Team. Archways. Archways is an organization that actually has 4 locations in Franklin, Tilton, Concord, and Plymouth. They are one of 2 recovery community centers that also has a family resource center embedded in it. So kind of a unique aspect there. And they have actually sought after and recently got awarded an evidence-based model through their curriculums for Sober Threads, which integrates the family and recovery services. In Plymouth, they do a lot of collegiate recovery work because they're right across from the university. In Franklin, they have an entire gym in their facility and do a lot of physical fitness. They work at the women's prison. They do a lot of youth services, Recovering Together cafes, and they are also their own training center. So lots of different things happening at Archways. Hope for New Hampshire Recovery is in Manchester. They are very art and music focused. So if you've ever been into Hope, they have this very long hallway. It is absolutely plastered with beautiful art, paintings, poetry, all things like that. They have a music room. They have a wellness clinic that does Reiki, acupuncture, yoga, and they also just recently opened some recovery housing. Keene Serenity Center is in Keene, New Hampshire. They operate a couple of specific programs for their centers. Road to Recovery, which is a transportation program. They provide free transportation for participants who need it to access any kind of appointment that they might need to get to. Grow is their syringe service program. And then they also do homeless outreach through Serenity Street Support. Navigating Recovery of the Lakes region is in Laconia, New Hampshire. They also operate a syringe service program called the Laconia Exchange. They do 24/7 hospital dispatch at the Franklin and Laconia locations of Concord Hospital. They are integrated into Belknap County Corrections, provide groups at Compass House, and they do a lot of youth and parenting groups, and also share Navigating Recovery staff help facilitate the doorway in Laconia. Revive Recovery Resource Center has locations in Nashua, Derry, and Manchester. They also operate a syringe service program called SAUNA through collaboration with the Greater Nashua Mental Health Center in Doral. They are part of their, They are part of their ACEs mobile response team, very involved in criminal justice integration through Hillsborough County drug courts and community corrections. And they are also CRSW trainers. So they help build the workforce across the state. Safe Harbor is in Portsmouth. They are a program of Granite Pathways. They have a very robust employment support program. They also do a lot of Reiki acupuncture and are involved in the recovery courts and have a great opportunity for community service. SOS has 3 locations in the Seacoast, Dover, Rochester, and Exeter. They do a lot of advocacy. They are the only RCO that offers an annual RICH conference, which is a conference based on harm reduction practices. They are NADAC certified trainers. They are integrated into state and federal recovery courts. They do 24/7 hospital dispatch, syringe services. They have a mobile outreach van. They do a lot of parenting and family ed groups and curriculums. And they're also very involved with recovery friendly workplace. TLC is the other RCO that is embedded in a family resource center. So they also do a lot of recovery and family-based supports. They collaborate with their local syringe exchange. They are providing groups and support at Sullivan County DOC. They are integrated into Family Treatment Court. They do a lot of collaboration with Dartmouth. They support the Recovery Friendly Workplace Initiative, and they also conduct a lot of homeless outreach. And then last one, Whitehorse has 4 locations up in northern New Hampshire, so Berlin, Ospey, Conway, and Littleton. Whitehorse also offers clinical treatment, so that's unique to them. They also own their own thrift store, which comes in very handy for some of their participants looking for clothes and things like that. They are a faith-based organization. They offer transportation, which is very critical up in that region for their participants. They do hospital dispatch, family support, and they are also integrated into the Recovery Friendly Workplace Initiative. And they run a print shop. Yeah, they do a lot of different things. Thank you, Catalina. So just really quickly, I wanted to talk about some of the data. You can actually skip this, but I'll talk really quickly that being able to oversee and have all of the recovery community organizations using the same electronic health record, inputting data the same way. So it really helps establish our collective impact. So we have a lot of great data and outcomes that come along with that. You can go to the next one. So the electronic health record that they all use is Recovery Link. It was developed by peers for peers, and again, Harbor Care oversees the use and training of it. So one of our primary outcomes is, I talked a little bit about it in the beginning, is recovery capital. We measure recovery capital through what we call the BARC-10, the brief assessment of recovery capital. It assesses recovery capital through 10 domains. Yes. Sorry, I'm just reading the chat. Recovery-friendly workplace works in collaboration with all of the RCOs. Yes. Some of them are more involved than others, but they all are recovery-friendly workplaces. Sorry, I lost where I was. So we use what's called the BARC-10 to assess recovery capital, which helps us evaluate the effectiveness of the services provided. These are the internal and external domains that the BARC-10 assesses. I don't have time to go into all of them right now, so we can skip this. So here's some of our data. So you can see some of our service numbers over here on the left for fiscal year 2024. And then over on the right, you can see that we have statistically significant increases in recovery capital for people engaged in our services. So on average, we'll see an increase of 3.18 points in recovery capital for those engaged in RCO services. We also, thanks to the work of Dr. Castedo de Martel, have a cost effectiveness calculator for peer recovery support services. Again, I don't have time to go into a lot of detail here, but basically you can see on the scale that New Hampshire state-funded PRSS all the way down at the bottom actually saves over $3,000 per person. And it is both cost effective and cost savings from a health system and societal perspective. So here's in summary, I won't go through it again, but just if you guys are not already familiar with your local RCO, please go introduce yourselves, get involved. They're always looking for integration and they're always looking to provide support to their communities. So there's one in every public health region. It is a free service for all participants. And it's been proven to be very effective at any stage of recovery. So they work across the continuum. A great resource to know. And then I think we are, I'm unsure, sorry, I'm just reading the chat. I'm not sure if RCOs is here today, but Elyssa may be able to answer. For the men's prison, reentry program for the men's prison. I do believe there are other RCOs that work in the men's prison, not our choice specifically, but there are RCOs that do integration in the men's prison. And then I think we're jumping to a breakout. Is that correct, Melissa?
Yep, thumbs up. Yep.
Yep. All right. So now we're going to put you in breakout rooms and you're going to have 10 minutes there and we're going to broadcast the instructions. So don't worry about that. But you're going to be transferred automatically in just a few seconds.
And then, Danny, they'll have a minute to report out when they come back after the 10 minutes.
Correct. Thank you, Melissa. Mm-hmm. Mhm.
To rejig a room. You don't want me in one of them.
Oh, okay. Yeah. No worries.
There's only one other person, so there might be a one.
Yeah, I'll check right now. I'm gonna share the instructions. Don't show this again. And PowerPoint share. There we go. Yeah, nope, we're all good. You were in a group of 4, one of the very few ones.
Okay, perfect.
Welcome back to the ones that already made it. There's still a few in their breakouts finalizing, and we'll be back in just a few more seconds. There they come. Welcome back, everyone. Hopefully you had some great discussions there with the proposed questions that we were sharing. And now we have a few minutes that we can take to report out the outcome of those discussions. Were you able to identify your local RCO? Did you learn anything new about them in today's presentation? And what are some opportunities for collaboration with you and your local RCO? We can go group by group unless there are some volunteers that are eager to speak out. If not, we can just begin with group number 1. We had Antonio, Caitlin, Megan, and Elyssa.
So I was nominated to report out. Elyssa, Antonio, and I just talked a little bit about, some of the work that I'm doing. I work with WellSense. I'm a care manager in behavioral health. So I work across the state. So it was just a nice refresher and learned a little bit more specifically about Whitehorse up north. I didn't realize, the extent of the programming they have. I was more familiar with their clinical programming. So it was nice to just get together and hear a little bit about where the 3 of us have come from.
Great. Thank you for those comments, Caitlin. We move on to room number 2 with Catalina, Drew, Melissa, and Rochelle.
Yeah, I was asking Catalina in a private message if she wanted to speak on behalf of our group. If she doesn't, then I will. Okay. So local RCOs from where we were included SOS, Safe Harbor, and then Whitehorse. And then as far as did we learn anything new about them, I learned something new about Whitehorse, the thrift shop I didn't know about. And I think that both of my colleagues, Rochelle and Catalina, learned something new about all the other RCOs outside of their regions through that presentation. And then lastly, what are some of the opportunities for collaboration? One was a Narcan training. Recovery Month is coming up. And then one of the things we were hoping to get from this is, can we get a link to where we can connect with all the RCOs, like the list, the phone list of that, and like kind of where they cover in the state. And that's kind of what we had. One of the colleagues was talking about expansion possibly to other RCO regions. So that's what we had for group 2.
Awesome. Thank you, Melissa, for the report. What about Annette, Kai, and Pam in room number 3? What can you share with us?
Pam, you want to share?
Sure. So we talked about where our RCOs are. Mine are, well, I'm statewide because I'm recovery friendly workplace, but I live in Manchester. So I have 2 here in Manchester, which is Hope for New Hampshire, Hope for Recovery, and Revive Recovery. Annette, they work predominantly with Whitehorse up in the North Country because that's their RCO, they're way up there. I didn't learn a lot new only because I work with the RCOs pretty much on a daily basis for my job, making referrals and stuff like that. So that's one of the things for opportunities for collaboration. But I also do tabling at events. We table at a lot of different events for the RCOs. We provide referrals to the RCOs. We get information from the RCOs. So for us, that's what we do. Recovery Month is coming up, so we'll be going to a lot of tabling events and going to a lot of rallies and stuff like that. Annette, what was it you were saying that you had learned today about the different RCOs? Maybe not Whitehorse, but other RCOs?
Right. So it's obviously do a lot of work with Whitehorse all the time in the North Country, but I thought it was fascinating to see the diversity of services that were offered across the RCOs in the state, and how they've all kind of found niches that provide really wonderful programming. And so, yeah, I thought that was great. That was surprising and great.
Thank you. Awesome conversation, obviously. Let's move on to room number 4 with Dan, Kate, and Lindy.
Well, I volunteered to be the spokesperson, so this was an interesting group. Lindy Keller oversaw this contract from its inception and was delighted to join us today and to see what's new and to appreciate the robustness of how far it's come in these 9 years. Kate works for Recovery Friendly Workplaces and has some interactions there too. Even before I was in my current position, I was interacting with the current director of Archways and looking forward to doing some more work outside of this role. So all of us were very impressed by the range of services and by the degree to which they collaborate with each other and how it's a large, it's several different organizations, but the collaboration is great. I mentioned to them that Nancy Fennell and I have been working on the MOUD and the D project for almost 2 years now, and part of that work is connecting people with local RCOs, and without exception, that those have always been pretty awesome connections to make. And just we were also happy with this presentation too, to learn so much.
Thank you, Dan.
Did I miss anything?
That was a great report, Dan. Thank you. Room number 5, we had Elyssa, Barry, and Monica.
I can quickly speak for us. So I think for us, it was a nice refresher of the different services and the different RCOs. For me, locally, the Archways in Concord, and probably just better for understanding the family resources there. What does that look like? And Elyssa, who works inside of the prison, we were just talking more too about the benefits of having a recovery support person for for the guys that are getting out of the prison, that are getting released, to help them acclimate back into their community, be successful.
Thank you, Monica, for those great comments. Then we had Danielle, Michelle, and Sarah.
Hi, this is Sarah. I can speak for our group. It's actually funny. I'm repping my RCO on my emotional support water bottle, SOS. All 3 of us have had contact with SOS. They're our primary RCO in Harbor Care, of course. One of the things that stood out to me was the sheer number of RCOs in the state. I didn't know we had that many, so that's wonderful. And it looks like there's 100% of the state covered. And one of the opportunities that we found early on, and Danielle agreed, the on-site collaboration piece is so critical to getting the patients to engage. We found that sending them out with a referral was only going to get you so far until we invited them on site and kind of automated the process within our clinical pathway, that we got really good engagement, and we just found that to be overall better fit for how we use them in our organization, and it increases adoption at the patient level.
Thank you for that great summary, Sarah. And finally, room 7, Carol, Jennifer, and Nancy.
Carol, I'm going to let you speak.
Okay. We have a good knowledge, I think, of most of the RCOs. We're all involved with them in some form or another. We talked about the growth of them from when they first started, I was involved in that, and the growth has been phenomenal since then. And we talked about some opportunities for collaboration and looking at the organizations we work for and trying to bring together the forces of the RCOs and peer support in some way to kind of gather our resources and work effectively together rather than in perhaps independent against each other, not meaning to, but just because we take different directions. So we're going to look at that kind of collaboration.
Thank you, Carol, for those great comments. And thanks again to everyone that reported out, volunteered or voluntold. It's all the same. So we still have a few minutes, as mentioned there in the chat. Thank you, Melissa. We still have a couple minutes. If you have some questions, we can take advantage having Elyssa here with us. Thank you, Elyssa. And they already posted some resources and links in the chat if you haven't been following. But Elyssa, I hand it over to you.
Yeah, thank you. Thank you. I do just want to do a little caveat that what I went over today for each RCO is not an exhaustive list of the programs that they do. I just kind of pulled out some things that made them unique. So really encourage everyone to get involved, go introduce yourself to your local RCO. But yeah, Caroline, did you have a question?
I did. Can you speak to any potential impact of recent state cuts and federal funding cuts in the kind of fiscal environment we're heading into over the next year, and what opportunities there are for communities to support their RCOs and, you know, for the sake of sustainability?
Yeah, that's a great question. Thank you. So there are several things state and federally that the RCOs are monitoring very closely. Federally, the recent changes that are coming forward with the block grant funds. This network is partially funded by federal block grant funds, so we're tracking that very closely. On the more local level, you know, the work mandates that are going into effect for Medicare is going to have huge impacts for all of our participants across the state. Funding wise, we are also partially funded through the alcohol fund, which is overseen by the Governor's Commission on Alcohol and Other Drugs. So that recent change to the alcohol fund, switching the dollars from liquor commissions to general funds, that potentially has a very huge impact on our network. That we are also watching very closely. And then so how to get involved, you know, making sure that you're aware of these and kind of advocating at your own local level, right? So the statewide network all revolves around those few funding sources that are going to have detrimental impacts to the network if it goes badly, right? And just thinking about, I hope what this demonstrated today is how integrated all of the RCOs are across the continuum, right? So to imagine that this network potentially goes unfunded, right? So just as an example, if the facilitating organization stopped existing, right, and they no longer receive funding through us, 15 centers would close immediately out of the 21 across the state. So this kind of funding and support that comes from BDAS is critical to sustain the network of centers. And these services all help in some way, shape, or form support all of your programs, right? So just thinking about the integration. So, I mean, I can't say it enough, like get familiar with your local RCO. They do great work, and please advocate and educate whenever possible.
Well, thank you for those comments. And unfortunately, we're run out of time, but those were great closing words, Elyssa. As mentioned, we want to wrap up, but we are running out of time. But we want to thank again Elyssa for sharing this information with all of us, and all the questions that enriched the conversation and the productive breakout room discussions that you had. Just a quick reminder before we wrap up, to explore more resources or to view today's recording once it's available, please visit nhtac.org. You'll also find previous COP sessions, recording, and upcoming events. Mark your calendars for the next COP so we can meet again. And I'm going to post in chat here the evaluation link, but we're also going to put it on the screen. If you can scan it with your phone, sometimes it's easier to complete this using your phone. Just remember, for those seeking CEUs, you must have attended the full session and also complete the evaluation to receive the credit.
Yep.
Please,
so I'll take,
yeah.
So we have not normally done CEUs for this particular COP. We're going to be offering CRSW, LADAC, and MLADAC CEUs. Those of you that have a different credential, please save the objectives and the description that came to you in your email. You do need to have been here for the entire session. We don't do partial time, so you need to have been here for the full hour. And then 2, you need to fill out the Survey Monkey, and then that will generate us to do certificates. Those certificates usually come a week to 10 days to your email. So that is something new and exciting. I want to thank Lindy Keller for prompting us to move in that direction. And I also want to thank our Zoom moderator, Danny, as always, for keeping us on time and just being just such a gracious moderator. So thank you. And of course, yes, Elyssa, I want to say a big thank you for your presentation. So that concludes today. We will see everybody back here in October. We do have a peer recovery support services COP coming up on motivational interviewing, and then prevention. We're going to be talking about marketing. So yeah, we have 2. Oh, and then lastly, we have ASAM coming in person September 22nd and 23rd for both the foundations and the skill building training for those clinicians, CRSWs that need that new 4th edition. So please pay attention to our to our emails. That's how you'll find out what's going on for all of the trainings that we have. And then don't forget that New Hampshire TAC also does technical assistance free of charge, as long as BDAS approves it. So if you have a project or something you're just dreading with data or need a PowerPoint with data, let us know. We are free of charge.